Good afternoon, everyone. Welcome to our webinar hosted by South African Non-Communicable Disease Alliance. Thank you for your time and also for joining us. I'm Zodwa Sithole, Head of Advocacy for Cancer Association of South Africa. I will be your program director today. I will be introducing our guest, sharing the messages and the stories from people living and affected by NCDs in South Africa. It is an honor to be part of this gathering. I'm so excited for this day. What is exciting me most is that this webinar is about people. So we will be hearing people sharing their stories, their experience, and how the NCDs has affected them. So guys, let's just enjoy ourselves this afternoon. Together with our partners, we aim to help to lower the number of NCDs-related deaths and also to provide care and support to people living with NCD, not only now during the COVID-19 pandemic, but even post COVID-19 pandemic. NCDs such as heart attacks, stroke, cancer, chronic respiratory condition, disease, diabetes, and mental health are currently the #1 cause of death globally and even here in South Africa. And it is expected that this number might increase by 17% by 2025. So can you please share your experience with NCD and participate? We need your input. Please see the short quiz poll that has come up on your comment section and also on the live chat. Please take a part in it is really a quick, easy quiz. It's really, it's totally confidential, and we won't be sharing any of your information. So if you can just participate, that would be great. Just about all of us are either living or we know someone who has NCDs. And we believe that people living with well-managed NCDs have a better chance of survival. We must keep on asking our government for people living with NCDs to have a proper access to care and also have availability of medication, and also how to build back better. And later on, we will be sharing the results of our quiz later during this session. Since we are now streaming live, if by any chance we get affected by load shedding, we will keep you posted. Please watch the comments below for updates, as we may have a quick switch over to a new speaker. So it gives me a great pleasure just to introduce our first testimony. It's all about Mata family. Lala, the mother, lives with her husband, her mom, her mother, and her 2 sons. All of them are living with NCDs, and some of them are having multiple NCDs. Lala is the only caregiver to this family. So Lala and her sons, they will be sharing with us their thoughts and experience of a family having to cope and manage NCD conditions. So we will take a few minutes to watch her story. Thank you.
mom of 66 years old was diagnosed almost 40 years ago with type 1 diabetes. My husband was diagnosed last year with type 1 diabetes as well. Then Yassine was diagnosed in 2006 at the age of 15 months with type 1 diabetes. And then Zach was diagnosed with type 1 diabetes in 2011. He also developed epilepsy and hypothyroidism between now and then. My first honest opinion is that I'm grateful for the medical care that we have received up until now. We are very fortunate that we've never been without insulin. Test strips from the public hospitals are usually a problem, especially in the adult clinics. The pediatric clinic at Joburg Gen are very, we're very grateful to receive 3 boxes a month, so that's almost enough for Yassine. But at the adult clinics, you only get 1 box of 50 strips a month, and that's really not sufficient. My biggest gripe at the hospitals is that they have clinics for elderly patients, for patients with chronic conditions, and there's no place to sit. So my mom's in a wheelchair at least, but it's so sad to stand in a queue for 3 hours until the clinic door opens and you're able to go and sit down, and for those 3 hours people are standing. It's a very, very common complaint that you hear from the people that are sitting at the hospitals, that they have to take off a whole day. And like you said, so many of them have lost their jobs, especially now, because it is a whole day thing. And then you go back every month to get your medication, which also can be the whole day's wait as well. So from an employment point of view, it's not easy to have an NCD and get your medication and 1 day a month you're not at work. Maybe not everyone can afford to give their child a phone to keep in contact with them. So you're relying on the administrative staff, the nurses, to keep in contact with you.
Well, for me, it's been hard at the beginning. Like when I was 7 or 8, when I wanted to eat something, and Mom would say no, I'd cry and I'd get sad and I'd have a temper tantrum. But now I know that it's for my own good.
You must be there to get the medication and be grateful of what you're getting, basically, because maybe it might not be for me, but it could be for my brother, it could be for my grandmother and stuff like that.
So at the clinics, they've had to incorporate methods to bring in social distancing. So they the protocols at the clinics have changed. Also, clinics, many of the clinics have requested, if it's not urgent cases, that you rather get an appointment at another date. And then that interaction with the doctors is also very much strained. I took it upon myself to learn everything that there was about his diabetes. It's the same with Zach as well, with his epilepsy, my mom. And it empowered me as accompanying the patients to the hospitals, that I could say to the doctors, look, I understand what you're trying to say, and I felt like I could work with them. Some parents and some patients unfortunately don't have the ability to do that, due to their resources available to them, and due to their circumstances they can't do that.
Homeschooling for me is really fun. You get to stay at home, you have your mom to help you. Yeah, so if I get stuck on something, I can always ask my mom and she'll explain to me and then I'll understand.
I hated homeschooling when it started. I hated it so much, basically, because I was at home, I would do work, and then the next minute TV. So there was no interaction with anyone, basically. And from that, I did lose a lot of friends from it, basically. But what I liked about it is that I used my knowledge, basically, and I learned things that I wanted to learn, basically. So that was nice for me, because I loved cooking, and from that I started building up knowledge of, okay, what is this dish? Oh, that's how you do it. And you experiment on what you want to study, what you want to focus on, and things like that.
Me and Zach, we in the morning we go down. There's a really quiet street just here, so we go past the ball there. We play soccer there. Yeah.
Soccer is our favorite, and we also we've done basketball, but we're not good at it, but we still like it.
Yeah, exercising, like some days we take a break because our legs are sore, and in one day you can see how different your glucose is.
The first question would be, why the difference between public care and private care? Now, we've experienced private care because Yassine has been on studies with private doctors. I have friends who have private care for their children, for themselves, with NCDs. And then we look at what we have to make do with at the hospitals. And although I'm very, very grateful, I really am, there are days when I say, why can we not have the same amount of care that the private patients get? So for instance, specifically with diabetes, with insulin pumps, with the constant glucose monitoring systems, which allow for less complications in people with diabetes. And I don't think our government understands that by managing a condition, you effectively spend less on that condition.
I've actually made more friends that are in public hospitals because we have more common ground. We know how the hospitals work, we know how the nurses work and that. But in the private care, it's completely different. You don't wait in line for 3 hours. You wait there for 5 minutes, you go to the doctor, they prescribe everything, and then you're out. You don't have to worry about, oh no, I don't have to worry about taxi fare, I don't have to worry about this and that.
Because Zach and Yassine have been fortunate to attend camps for children with diabetes, they see the vast difference in public care and private care. From an aspect of managing, from the aspect of foods that private patients can afford for their children, compared to what experiences of other families when we are at the hospital.
Say go on more camps, experience more things with people, because it will open your eyes to see how many people there are with diabetes and with everything.
I don't think maybe the powers that be realize that it's not just about your medication and having hospitalization that covers your needs, but it's also could you perhaps call it the social aspect of it? We push upon the patients that it's about their management, their eating, their medication, their diet. But what about the socio aspect to it, of having facilities available, support groups for people who are supporting family members with NCDs?
Whoa, that was great to see young people who have NCDs that are raising awareness and learning how to manage their NCDs. Lila, we are so proud of you. You are doing a great job for caring for your family. We are so proud of you. So the next item on the agenda now, we have a message from the World Health Organization regarding global NCD intervention impacted by COVID-19. Can we take a few minutes to watch these messages?
Political stability. That means investing in population-based services for preventing, detecting, and responding to disease. This will not be the last pandemic. History teaches us that outbreaks and pandemics are a fact of life. But when the next pandemic comes, the world must be ready, more ready than it was this time. In recent years, many countries have made enormous advances in medicine, but too many have neglected their basic public health systems, which are the foundation for responding to infectious disease outbreaks. Part of every country's commitment to build back better must therefore be to invest in public health as an investment in a healthier and safer future.
That was a great message. Thank you so much. So now we are going to have our own African NCD champion, Zolega Mandela, also shares a message of support to build back better. Let's watch her.
I'm Zolega Mandela, and I'm a two-time breast cancer survivor. I wanted to be a glimmer of hope to the lives of the vulnerable, those who are less privileged than I am, and most importantly, to in a way ensure that their voices are heard. Many women fighting NCDs and fighting NCDs like breast cancer are dying, have been rendered silent, and unfortunately don't receive the treatment that they deserve because of where they live in this world. But I think we need to encourage those living with NCDs to speak out. We need to build strong alliances, and I think we need to create a movement of change that's going to put pressure on our leaders to actually pay attention, for them to actually take action.
It is now give me a great pleasure to introduce our main participant of the day, the Director of South African NCDs Alliance, Dr. Vikki, a passionate NCD activist, person living with about 20 NCDs. She has a doctorate in person-centered NCDs, management by nurses in clinic settings. She has on the ground hard-earned experience of many health settings, including rural, urban, private, public, universities, civil society, and NGOs. Over to you, Vikki.
Hi, good afternoon. My name's Vikki. Thanks for joining us today. It's so good to have you all here with us, and for the people who are working hard behind the scenes, and for all the wonderful families and people who've shared with us. So I'm here today not as Dr. Vikki, but as just Vikki. I'm a person living with lots of NCDs, as you have heard, and I've been doing it all my life. Some of them are really a pain, but I do it and keep going. And since the beginning of COVID, I've been shielding. You know, that means staying out of harm's way, because as you see, I'm really old. And then I actually have a problem, you know, then I'm at risk. I've got diabetes and other NCDs, so I'm at risk of dying early from NCDs if I get COVID. So what am I here for today? Well, I'm here today because I want to talk about NCDs in the context of COVID-19 and how we build back better. As Dr. Tedros from WHO says, and he's been jolly busy, hasn't he? Well, he's been busy saying that the health systems haven't worked for us in the past, and not really for NCDs. We really want to have an equitable service that looks and feels like what it is for HIV and TB. And then we can move forward. So here we are. Please may I have the first slide, because I want to show you a little bit about Emmanuel's behind the scene, and he'll put up a picture for us, and then I can see it and talk about it. So one of the big things that happens with NCDs is that we've got to keep them under control. And as Layla said, it's not easy to keep control because your sugar's always moving up and down and all the rest. And if you can see the picture on the slide, then you can actually see that at the top, if you're free and your blood sugar is high, is well controlled, at the top of that stairs, you're going to do so well, and you will be controlled, and the chances are that you will survive a COVID-19 infection. But if you get poorly controlled, as many of us are, because maybe we're not getting the right services or we're not doing it right, and I have been badly controlled with my diabetes often, then it means that the chances of dying if you get COVID are much higher. Thank you. So when the slide, I don't need the slide anymore. So that's really showing you the bottom line of what we really need in our country is to have outpatient facilities and clinics that really care for people who live with these multiple NCDs. And most of us live with more than one, and people with HIV will also live with the same thing. So what we're asking for is to improve that care. And, you know, I was in transition into the public health sector because, number one, I can't afford the medical scheme and all my insulin anymore. And so I was busy transitioning to get care in the clinic when, unfortunately, COVID came. And so I've never made it to, actually not a clinic, but you know, I haven't been able to go to the public sector, so I'm still buying my private medication. And I hope that we can find it. So why do we really want to look at public and private? So if you can put the two slides up, please, Emmanuel. The two slides are showing us what in a recently published document that said, this is what the recommendations are for care for people living with non-communicable diseases. And what they're showing us is, and talking to us about, is that we need to be able to get our medicines safely. We need to have clinic visits, telephone calls. We need to use the technology that's available. And of course, we need the bandwidth and we need the free access to data. So all of those things are important. So you can see these little slides that are made from it. And using phone calls rather than making people wait. Minimizing face-to-face contact. Now, all of these things are going to take time and effort to sort out. And I'm not going to go through all of them. But we've really got to be able to change the way in which we deliver care so that it is effective and efficient in this time of our lives, and possibly for another year. So does it mean that I'm going to not be able to get to a hospital or a clinic in the public sector for another year, or whatever it is? I've actually got to go to a hospital to get my medicines because I'm on insulin and I can't get it in a clinic. And so those are all the kind of things. And these are recommendations that we believe can work if we empower people rightly and we perhaps start doing things differently. So those are the recommendations of how we live for the future while we've got COVID or the next pandemic. How do we do that? Now to the final slide. Thank you. So what are we talking about? Well, you heard Dr. Tedros talk about building back better. It really sounds like some kind of a B-E-B-B-B-E-E-E, whatever it is, for people who are living with NCDs. But building back better is acknowledging that the problems that we have in our health service can be fixed. We want to be positive, we want to work alongside government, and we want to build a better system for all of us going forward. And this is one of the things. Now, people are measuring how much PPE we have and all the rest. Those things, have you got masks? Have you got this? Are you getting the social distancing? But there are critical things that we need to be measuring for all people with NCDs, especially in the public sector. And that is, do you get your food and medicines? Are you getting your test strips? Are you able to get them easily? Are the stocks in place? Like my insulin, I have to find a public hospital that is very far from where I live. So then the other parts of this, can you just put that back on that screen, the last one? They're also looking at how do we get our services, for example, to be back to the best place where we need it to be. So we want to build back better, and that's a partnership with people who you'll meet in the panel discussion. And we really need it to be about us and what we need. And we're so grateful for everything you've done. So let's build back better in partnership so that we all live longer. And I want to live another 2 years until I'm 70. Then I won't be dead prematurely. Thank you. Bye-bye.
Agree. Sorry about that. Vikki, that was powerful. We really agree with your suggestion for people living with NCD. Yes, we need to build back and better. Thank you so much for that. So it's my pleasure now, and we are also very honored to have our input from the National Department of Health of South Africa. So it's my pleasure to introduce Ms. Sandra Singh, who's the Director for Non-Communicable Disease from our National Department of Health. Thank you, and over to you, Sandhya.
Good afternoon. Thank you, Zodwa. Greetings to members of the Alliance, and a special greeting to the public who are joining us this afternoon. It is my pleasure to offer a very brief message on behalf of the National Department of Health. And in doing so, I would like to congratulate the Alliance for hosting this important webinar, for allowing a conversation on a very important topic, namely creating accountability between government and civil society, but also looking at how do we act now and how do we act together. When we look at accountability, I think it's very important for us to understand some key concepts. And the first thing is, we often hear about civil society engagement. For government, we need to ensure, what do we understand? What is the meaning of engagement? Do we as government have the same common understanding as our partners? And in understanding engagement, we also need to understand the circumstances of the patients on the ground, their families. What is it they eat? Where do they live? How do they get to services? And I think it is this understanding that informs an engagement And unless government officials understand these situations, it's very difficult for them to respond. The second issue is, in terms of accountability, relates to the issue of enablement. It is all well and good for government to tell people on the ground, why do you not eat healthily, when our most healthy foods are the most expensive? How do you explain to a mother that you should not spend your last 5 rand buying something unhealthy to fill up your child because it's unhealthy? And how do you then provide for this child? So government has, in terms of being accountable to civil society, we need to enable. And enabling also means understanding the circumstances of the people on the ground and engaging with civil society. And the third area of creating accountability from a government perspective is to understand what is clinical governance and to understand why is it we are failing to ensure that a simple thing like guidelines are not implemented. Why is it our patients don't have access to the minimum medicines and consumables? Is it because of a lack of resources, or is it lack of training? Or is it just a lack, unwillingness to be able to implement good, clean clinical governance? So I think the message that we have is government needs to understand the situation better. And in doing so, we need to understand how we work with you and walk with you as partners in terms of changing the quality of lives of patients, the population at risk, as well as the families with whom these patients live, who experience tremendous hardship. So my message is, Vikki, you and I go back many, many years, many difficult years, but this is a commitment to working with you. And I've been told on the chat that Big Brother is watching. So thank you very much. Over.
Thank you, Sandra, for that message. I'm the one who's going to hold you accountable for what you said today. And thank you so much. And I'm looking forward to engage further with the Department of Health on what was discussed today. Really, thank you so much, Sandra. So thank you for your messages and participation, and willing to take up accountability so that ongoing care will be provided. All of you that are tuned in, if you have any questions or messages or input, please make use of the comment section below or live chat. Thank you. Please just keep on sending those messages and input. So now I'm just going to introduce our next video. It's time for us to share our next patient story. This is also a caregiver, Mr. Julius Zamora, who lives in Mpumalanga and is a father to 4 children. Him and his wife, Mavis, were both shocked when their youngest child, who was 7 years old, diagnosed with leukemia in February this year. Julius shares his account of what it is like to be a father and having to cope when your child has NCDs. So can we take a few minutes just to watch this video? Thank you.
he was diagnosed with leukemia on the 18th of February this year, 2020. We went to Rob Ferreira, and with Rob Ferreira, that's when they quickly diagnosed that, no, this is something different. He needs to go to Steve Biko. So to us, there as we're moving, we saw that there's something wrong with him now. And when we got to Steve Biko, that's when we got the diagnosis that this is leukemia, it's cancer. I just thought maybe it's a different place now where we are. It's just going to get some medication, then we go home. But later I heard that this is a cancer ward. The kids that you're seeing that are running around, they've got cancer. That's when I got a shock now. Like, really? So this is where we are? And I was in shock. Not having for me somewhere to stay would have also caused a lot of challenges for my son, because I will not be able to see him when he was going through the times of hard times during chemotherapy. And you know, him was also adjusting to the scenario around him, like the machines and everything. But the most good part that happened, that removed all our stress, is the cancer lodge that we managed to get ourselves into. We were offered this place. We were told, in a way, that there is a place where you can stay while the child is getting treatment, and also you have somewhere to rest, somewhere you can interact with other parents. You be provided with food. You don't need to pay for the rentals. You don't need to pay for the food. You just have to be there, and also maybe open up to others and also learn from what they are going through. And it has been a blessing. Yeah, it's been a strain to the family, yes. You know, in life you never expect to save as much for this kind of things to happen. Yes, we know there are things that happen, but you don't have enough time to save for these things. And it was a surprise. It was something that came as a shock also, as well. Yeah. With Ain, when he was born with clubfoot. So also it was a shock when we didn't know much about it. Is one person who's teaching us more of medical things. So when he was born with clubfoot, and we had to go through rehabilitation for his foot to be corrected. Most of the times we used to share the duties. Usually as the mother was going with him, when she's gone, she has to suspend most of her work, and maybe she's got other orders to do. She has to give them later dates for the orders to come out. There's this kind of sicknesses. We tend to think they're sicknesses that will go away. So there are so many kids out there that are facing the same problem. Maybe it's just a little thing, but they just keep thinking it's going away, and yet it's spreading all over the body. And by the time they realize this thing is big, then it's too late. The moment he was sick, he was all down. You know, he was lying, and he was always in pain. You could tell he's in pain. He was in pain, and it was terrible for us. And it was also terrible for him. We felt for him as much, yes. The first thing I'll say, they need to support him. They need to look after him, encourage him. And it's something that he never asked for, so we need to be there for them. And they will be going through hard times, and they just need to understand them, especially the emotional part where they are very moody and so on. They just need to understand them and care for them. Even other diseases, you know, the government can build something like this on every hospital, where even families can come and stay together during these times when somebody's getting treatment or when they really need a family unit. It will help a lot. Because one thing we need is we need an awareness of the sicknesses, the diseases that are going around in the world. And we as families, we also need to understand them and have an awareness of what is needed to these people to help them out. And we can only experience this when we are close to them. It's not only in the wards that we visit them for 1 hour, then we understand them. It also needs, when they are out, we get to know what really goes on even around other patients. Because when you're in that kind of facility, you're exposing yourself to other people also that are suffering from different diseases. You get to know what it is when somebody is sick and what's going on. And as communities, we may be able also to help out to the government as well.
Thank you so much, Julius, for sharing with us that journey you have been traveling of having a child living with NCDs. And for me, the highlight from this video, which is very important for healthcare workers, that the communication is so important. You can imagine you are being referred to another hospital and you only know about the diagnosis of your child when you are there. Thank you so much for sharing with us your journey. So we have heard from people living and affected by NCD, their experiences and how they cope. We have also had input from the World Health Organization and also from our own Department of Health. So thank you so much. With participants representing some of the civil society and people living with NCDs. So unfortunately, we couldn't include all the civil society because of the time limit. So before we meet the panel, if you are watching and would like to ask any question of any of our panel, please ask your question in the comment section below or on the live chat. We will later share them and discussion on those questions. Thank you. A warm welcome to our panel. Can each panel participant introduce themselves? And because of the time limit, I'm just going to ask you just to share your name and from which organization are you coming from or who are you representing. So over to you.
You've heard from me already, so I'm not going to reintroduce myself. And you've heard, let's hear Sandia, and then we'll go to Maggie.
Well, thank you for inviting me to join the panel on this webinar. I'm Maggie King. I'm the director of the Tandanani Center, Brothers of Charity Services. We are an NPO, one of about 43 in the city of Johannesburg district, representing people with psychiatric disorders. Other NGOs look after people with profoundly disabled people with physical or intellectual disability. We have about 61 residents, or as the Department of Health calls them, mental health care users, that utilize the state facilities, clinics, hospitals. And we find that some of the stories resonate perfectly. The long queues, the shortages of medication. And so we are looking forward to the Build Back Better and in partnership, the new dawn, hopefully, where maybe we can get computerized in the hospitals paperless, have our mental health care users seen as individuals rather than a number, and that quality care from initial start to when they're cured, for example, a physical illness, would be greatly something to look forward to, greatly needed. Thank you.
No, thank you so much from all our panel. Thank you so much. I really appreciate your time. So I think from all our the discussion and the messages and stories shared by people living and affected by NCDs, can each of you share what you have heard today and what your thoughts and highlights? And because of time, ladies, please, I'm just giving you 3 minutes. So we've got limited time, just 3 minutes. So can you share, can I start with you, Vikki, again? Can you share with us, what you heard today from this discussion? So what are your thoughts and the highlights of today's discussion?
Well, I'm very grateful, thank you, for people sharing their stories. I think for me, these are just the tip of the iceberg. And we are grateful that we have got a health system that can do so much. And I think we look forward to working in partnership. What we're hearing is that non-communicable diseases are a lifetime. They don't get better. And so, by and large, I know that I won't get better, and I know that for everybody, most of the people on there, it will be a lifelong journey. And so we need also to deal with things like that have been seen the exclusive territory of certain illnesses. Stigma, for example, is part of mental health and cancer. It's part of HIV, but it's part of everybody's experience. I was stigmatized as a child. I was called a leper because I had a skin disease. And so I'm hearing a lot of pain, but I'm hearing very hopeful people, patients, who really want to work with Sandia and the provincial districts and the councils and the people that we've all known for all of these years. We can do it better. And we've got to do it better. So we look forward to working in partnership, and also you saw how willing we are and how everybody's family says, we're so grateful for what we do get. Couldn't we just do a little differently? So that's me done. I don't think I can hog any more time. I think it must be up to Sandia and Maggie.
Thank you, Vikki. Before I hand over to Sandia, I agree with you. We cannot do this job alone. We need that partnership. We need to come together, strong voices. I think they make such a difference. We need partnership with the Department of Health. Thank you so much. Over to you, Sandia.
Thank you, Zodwa. First and foremost, allow me to congratulate the patients and their families on their brave voices in the videos. It is absolutely critical for government to listen to the patient voice. And in was being said to us about the impact of the huge gap between public and private sector, and how that impacts on the quality of lives of the patients. And it was really touching when the mother mentioned that, yes, it's all well and good to be able to provide, have medicines, but how do you then ensure that there's socialization? Because life is about balance. And these children and the youth need to be able to live in a balanced world. Secondly, I think it is absolutely, I congratulate the voice of the youth in the video. It is important for us to be able to hear the voice of youth. I think youth have an extremely powerful voice. not only to be able to change the way in which services are delivered to them, but also they can be change agents. Now, well, let us look at the concerns we have around obesity. And when do we look at the onset of obesity and how youth can play a role in terms of changing the trajectory of obesity by not only impacting on their own behavior, but taking messages home to change the behavior of their family members and to promote healthy lifestyles. So well done to the voice of the youth. And I think that you will play a critical role in terms of changing the responses. It is extremely disheartening when we have to listen to parents of children with NCDs. I've often been in a meeting when a parent would stand up and say, I wish my child had HIV or TB because my child would get services. My child has diabetes and my child gets nothing. My child has cancer and my child is not getting it. And this has been an extremely difficult situation. I think one, in terms of the initial lack of priority of NCDs generally, adults and children. And while we made certain strides to improve care, access to care by adults, we are sorely lacking in creating access of care for children. But not only children, we have to ensure that the care is holistic, in that parents are directly involved and catered for in their care, but also access to schooling, because we've got to ensure that their schooling is definitely, or their needs for education are addressed. I want to assure the families and the parents that work is being done. I know it sounds so cliche coming from a government official. I could easily be a politician right now, but please be assured that issues are being addressed, especially, and you know, I feel really bad that talking about children with cancer, but we're hoping that a new policy and guideline that will come out soon will address this. But it does not mean that we shouldn't continue to address the needs of all children with NCDs, not just cancer. So yes, please continue your advocacy. Government needs to hear your voice. And I want to encourage optimal use of the voice of the youth. Thank you, Zora.
Thank you, Sandra. That was so powerful and also reassuring us that you are doing some work to attend to our needs. And again, I'm repeating, I will hold you accountable for this. No, thank you. Thank you. Maggie, over to you.
Well, besides reiterating some of what was said previously, specifically about the soul-destroying experience of sitting in a queue while waiting to get your medication, and then to get to the front of the queue and say, sorry, nose up, prick, sir. No, we don't know when we're going to get some. And then they come back to us, and for a schizophrenic to not have her or his medication is, you head for trauma. So the NGOs have to find the resources to come and buy the shortfall. Last month we spent 11,500 Rand on the shortfall of olanzapine, rather than have to take anybody to the psych ward, which is, you know, overfull, as we know. I must say, it's so refreshing, Sandhya, to hear what you have said, because it's like, wow, we're on a different page now. I'm quite excited, because we've been going since 2001, and I'm absolutely exhausted. The system has exhausted me. I'm not broken yet. I still have a bit of hope and a bit of optimism that things will change. We see ourselves as a voice for the voiceless, and if we do not campaign for them, nobody will. They will just be stuck in that queue system. And as I said, it's torture. Those two young boys that were talking about it, I thought, yes, we know about that. It was actually quite sweet to hear it. It's not just mental patients who are sitting in a queue waiting for antipsychotic meds, but it's everybody that's experiencing the system that we have now. And I think the system, COVID has shown it to be quite broken. So build back better in partnership with the attitude that Zambia has said she's looking forward to. I'm going to get my patients to open their mouths a bit more. We've been giving them, we've been trying to assist them to remove the stigma that they have against themselves having a disorder. And hopefully the rest of the world can see mental health rather than mental illness. Nobody asked to be born with a disability, a disorder, an illness, but there are a lot of people that are living with it that need to be recognized as human beings, and that to go through a health system and be failed by this health system every single day because it's just not up to scratch makes it very, very difficult. It's sold as, it just crushes the spirit. So the 21st century is upon us, and I'm looking forward to seeing the new way forward. Thank you.
Thank you so much, Maggie, for your message and for your thoughts. And again, thank you to all our participants. So you remember earlier on, we participated in the quick quiz. So I'm going to ask Lucy from Cancer Association to share the results of that quick quiz we were doing. Thanks, Lucy. Can you please share the results of that quiz for us? Thank you. With us, please.
Hello, everybody. Really exciting to be here and great to see the participation and the input. I'd just like to share that from the comments, we've had a very nice positive comment from the Biokinetics Association talking about how biokinetics is actually the cornerstone of NCDs. And again, also from our side, to see the stories shared by patients, very important to share their real personal experiences on the ground, and wonderful to see the comments or perspectives by the National Department of Health. Thank you for Sandhya for sharing that. I think that's so important that we all work together, civil society, and collaborate. As we say, we are the voice for our patients, and we can only improve the system when we work together. So from the results, very interesting. So Emmanuel, perhaps you can just share on our screen. A lot of our audiences have taken part in our audience, and we've got about, I think there are just over almost 100 people that took part. Interesting, we asked only 2 questions. We asked you whether you make disabilities. You had to say yes or no. And 70% of people watching at the moment don't make use of health facilities. So it just shows you how many of us are dependent on the health system, and 30% have private care. And then interestingly, if we have a look at the survey at the bottom, you had to pick whether you or a family member or a friend currently experience any of the sort of following NCDs. And it seems that many of our audiences have got high blood pressure, 75%. We've got many of them drink alcohol more than 2 units a day. We've got people that are experiencing heart attacks or stroke. That's also a concern. We've got many that have got asthma, 33%. And we've got many of us that are watching are over 55 years old, about 58% of us. So it's just interesting to see, and 25% are living or are being affected by dementia or some other mental health conditions. So I think the importance of this webinar is now coming to the fore to show how many people in our audience are living with an NCD, and how many of us can take an active role in managing, and how we can all work together. So I think that's it from our side. Thank you.
Thank you so much, Lucy. But I think it's really confirmed that we have been saying that, you know, almost all of us, we are either living with the NCDs or we know somebody who's living with the NCDs. And really, Sandra, I like what you said, highlighting that, you know, NCD patients, sometimes they say, I wish I have HIV and AIDS because I'll be able to access my medication. I wish as from today, our patients, they will say, wow, that day has come when I won't wish to have HIV because I have access to care, I have access to medication. And thank you so much. So as we are coming to the end of this webinar, I just want to thank you, all of you guys, thanking the people who participated, our patients, families, caregivers. We really want to say thank you. Our voices together are so important. I really want to say thank you. And they're asking, Sandhya, I'm sorry, I'm on your case today. And we are asking our government to join us to build back better NCDs, prevention, and care in the post-COVID-19 response. So thank you again. Thank you to all our guests, and thank you to our guests and to all our participants who are all helping to make our voices stronger. So here's the last message I want to say. Until government addresses NCDs and integrate NCDs prevention into their policies, our country will remain unprotected if the virus continues to spread or if there are further future pandemics. So thank you, really, thank you. Have a blessed afternoon.